The modal age of onset for bipolar illness is 18. Now, Demi is 18 right now. So that's about the time when just as many people are diagnosed for the first time who are older than 18 as who are less than 18. So she's at right about the age, but in looking back, she probably has had symptoms for some time. And anorexia nervosa, or an eating disorder, often is a type of a depressive disorder, or at least there's a connection between depression and eating disorders. There's a common inheritance, a common family history, and there's very common comorbidity between the two. So it's not unusual to see someone who starts out being anorexic, and later we find that they're either suffering from major depression or bipolar illness, or a combination of the two. So I'm not at all surprised. The cutting is, again, something else. Self-cutting is not suicidal behavior per se, but it is a way to relieve tension or anxiety that is just overwhelming. Oftentimes it's associated with a great deal of trauma early in life. It can be sexual, physical, emotional, or usually sexual trauma. But a person finds that they can relieve that tension by cutting on themselves, and then it becomes an addiction of its own, or in itself. And it's also something that's kind of difficult to give up. I've seen women in their 30s, 40s who have progressed from self-cutting to burning themselves with like a hot iron because they no longer get the same response from just cutting it. I knew a young woman in her 20s who would burn herself with cigarettes until her entire forearm was pockmarked with cigarette burns because the cutting just no longer did it for her. In essence, it is like a poor man's addiction to opioids. What the self-cutting does is that it releases endorphins, which are produced in the body, and it causes a sense of well-being, or it takes away the emotional pain. And a person can become addicted to the cutting, not to the pain itself, but to the release of endorphins, which causes a feeling of well-being and euphoria and so on. As a general rule, a combination of talk therapy combined with medication, if it's a major mental disorder, and all the major mental disorders are basically brain disorders or neurologic disorders. The best outcome is if you combine talk therapy with some type of medication.